Hello, my name is Amanda Mackay, Nurse Consultant for Learning Disabilities, and we have made this video to help people with learning disabilities who are coming to Calderdale and Huddersfield NHS Foundation Trust for a pre-assessment appointment. We want to support you the best way we can, and if you tell us that you need reasonable adjustments, we will try to help. For more information, you can go to the Trust website. The pre-assessment service is at Huddersfield Royal Infirmary and is on the lower ground floor. If you drive to hospital, we have car parking facilities. You can find out more information on our website. Bring a list of the medication you take each day and any medication you take sometimes. If you already have a hospital passport, then bring this with you or ask the reception if you can complete one while you are waiting. Bring things that will help distract you while you are waiting, such as a magazine, earphones with music, sensory toys and something to eat and drink. If you need reasonable adjustments, you can get in touch with us before your appointment so we can accommodate. This might be needing a quiet area to wait, waiting in your car until your appointment, or a hoist. You may have a physical examination such as a blood test or ECG, so wear loose clothing. Prior to your appointment, you will receive a triage form via a text message or email. Please fill this in before your appointment. If you need help to fill this in, let the department know and help will be arranged. You can follow the signs to the pre-assessment department, or you can ask at the reception desk for directions. Sometimes there are volunteers wearing yellow t-shirts who will guide you to the pre-assessment department. When you arrive in the department, you will check in with the receptionist who will check your details: name, date of birth, first line of your address and your next of kin details. You can ask to speak to the nurse in charge and you can show them your hospital passport. You can talk to them about any reasonable adjustments you require while you are waiting or while you're in the department. Once you have checked in, you will be asked to wait in the waiting area until your appointment. Your name will be called when it is your time to go in to see the nurse. You will be shown which room to go into. The nurse will introduce themselves to you and anyone else who is in the appointment. The nurse will check your name and details and can read your hospital passport, or you can tell them any reasonable adjustments you need. A family member or carer can stay with you in the appointment if you would like them to. Show the nurse the list of medications you take and any other information you have brought with you. The nurse will ask you lots of questions and may want to do some tests, take your height, weight, blood pressure and other observations. They might take some swabs of your groin and nose. The nurse can do these or you can do them yourself. You will be given the choice. They will measure your calf for the stockings people wear in hospital. The nurse will talk to you about any more tests they would like you to have, which will be in the department on the day. For example, a blood test or an ECG. You will be asked to sit back in the waiting room and will be called when it's your turn. You can ask the nurse any questions or explain the information to you or your carer. You can ask for the information to be written down or in an easy read leaflet or video. Sometimes you need to be reviewed by an anaesthetist. This might be via telephone or in a face-to-face clinic at pre-assessment department. It may happen on the day of your appointment. You will be given verbal and written fasting instructions from the nurse. They will tell you what time to come into the hospital and which site. They will give you lots of information to read prior to coming into hospital. You can ask questions at any time or ring the department to check any of the information. Thank you for watching this video. The pre-assessment department are here to help. If you need support, please get in touch.